Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Words of Wellness. I'm your host, Yassir Al-Manawi. I'm a clinical therapist. If you remember from our last episode, we were talking about core issues and we were talking about fear, and we related that to the hadith about forgiveness of Allah subhanahu wa ta'ala. And we also closed the last episode with saying that we should not fear anyone but Allah, because it increases the amount of fear in front of us. And I can actually tie this up to motivation too. If you remember, we talked in several episodes about motivation, motivated by excitement and motivated by fear. That's why we have to face our fears. Now, fear is actually a feeling, just like any other feeling. Fear is a feeling that is not like anger. It's way down there, like sorrow and disappointment and everything else. So what we need to do is that we need to talk about how do we identify our anger, or how do we identify our feelings? How do we have feelings management? So we're going to talk about that and illustrate that in this episode. Feelings management as opposed to feelings mismanagement. First, let's talk about feelings management. How do I realize that I have a feeling? A lot of people, they walk around every day, and if you ask them, what do you feel? What's your feelings? They don't have a clue. They don't know what they feel. So what do we need to do? First step, I have to realize is like, I feel something. I'm a human being. I feel something. Why? Because I feel something every minute of the day. So that's the first thing. I have to realize that I have a feeling at every minute of the day. The second step, I have to identify this feeling. If somebody comes to me and tells me, I feel something, it's normal for me to tell them, well, what do you feel? So if I ask myself that I have a feeling, what do I feel? So you see now, I said I have a feeling. Now I'm going to label the feeling. And now the third step is what? I have to affirm the feeling. How do I affirm my feeling? I affirm my feeling by making sure that the feeling that I said, for instance, if I say, oh, I feel something. Oh, I feel angry. See, first 1 and 2. I feel angry. Now, number 3 is affirmation. I feel angry. Why do I feel angry? I feel angry because my brother disappointed me. He was supposed to pick me up and he didn't. So what's my real feeling? Is it anger or disappointment? It's actually disappointment. That's why we always say anger is a secondary feeling, not a primary feeling. So my feeling after affirmation from anger became to disappointment. Now the fourth step, what do I have to do? Now I realized, I put a name, I made sure that this name is correct. Now, number 4 is that I have to communicate the feeling. Communication is very important. Communication is highly important in our lives. How do I communicate the feeling? Well, if I feel disappointment towards my brother, what do? Do I go there and tell him? Yes, I do. What about if he's not there? Well, I can write it down. Well, somebody might ask me, well, if you write the feeling down, what good is it going to do me? Writing the feeling down takes the intensity out of it. Like, let's say if I'm very angry and very upset and I start writing it down, you're going to find that the feeling of anger and upsetness went from way up here, like 100% to maybe 60%. And then after that, I think about it again and then I start communicating it to somebody. Then it's going to go from 60% to 40%. That's how we deal with the feeling. Let's see if we don't follow these steps, what's going to happen? What's going to happen is the feelings are going to be exaggerated. The feelings are going to be transformed from one to another. For instance, I can give you a feeling of I'm angry at somebody. I don't talk about it. I keep it to myself. What happens to the feeling after a few months or a year or 2 years? It changes and it transforms from anger to hatred. There is a huge difference between anger and hatred. Another feeling is sadness. I don't talk about it. I say, oh no, I can take it, I can handle it. I can take it, I can handle it. And then at the end, what happens? It becomes depression. Depression is totally different than sadness. But only then people would realize and say, well, oh, I have to go and see a doctor now. I have to talk to a psychiatrist. I have to talk to somebody. We need to avoid that. We need to learn how to manage our feelings from the beginning. Let me give you another feeling that's positive. All feelings are, by the way, healthy or unhealthy. They're not positive or negative. Feelings such as love. Everybody would say, well, love is very good. If I don't talk, I got married, and everybody gets married to their wives because of the love between both of them. If they do not nourish their love, and if they do not talk about it, what happens? The feeling of love transforms into obligation. Okay? Obligation is totally different than love. Something like strength, it is a healthy feeling, and it's positive feeling. What is it? If I don't talk, if I feel strong and I don't talk about it to everybody, if I don't talk about it and share it with people, what's going to happen? It's going to be grandiosity. Grandiosity means that I walk around and I feel like I'm God's gift to everybody. See, when the feeling transforms from its normal position to the exaggerated position, that's when we start feeling the psychological and emotional imbalances. Okay? If you see somebody who's depressed, if you see somebody who's arrogant, if you see somebody who is isolated, that's the sickness. And we take them back to the main feeling, to the real feeling, and we start from there. So I thought it was very important to talk about feelings management as opposed to feelings mismanagement. Now, when we're discussing feelings management, the whole idea is what? The whole idea in therapy is what? Is to lead a comfortable, happy, satisfactory life. You're satisfied with yourself. You're happy with yourself. As opposed to being miserable, as opposed to being angry, as opposed to being dysfunctional. So to get into the healthy side, you have to identify your feelings with the steps that we talked about. You have to talk about your feelings and communicate it. And you have to be aware of your actions at all times. You cannot just stop and give up at any given time. And you know what? A lot of times in my career, what I realize all the time is that in treatment, I find myself applying a lot of the techniques that we actually have in hadith, that we actually have in religion. That's why I always say it was given to us to lead a healthy life, to lead a comfortable life, to lead a happy life. So I hope that this episode was beneficial to you as it was beneficial to me, because I do remind myself every time I talk about that, I remember and I go back to the basics. So I wish that everybody would do that. And we'll see you in our next episode, Words of Wellness. Assalamu alaikum wa rahmatullah.